We have moved to crisis standards. There are places, as I say, that cannot meet their normal requirements. The blood system is stressed in the hospital, but wider in the region. The lack of blood collection means that many hospitals across the state do not have enough blood to meet their initial needs. Normally, they would try to have 3 days' supply. Today, that supply is less than 1 day, and so they are allocating it out to the various small hospitals because everybody's down a little bit. And if somebody gets down a lot, that's a threat. We try and keep several hundred units of blood available at all times. And patients who come into the hospital, we blood type them and check them for antibodies and then issue blood to them as they need it. On Thanksgiving Day, 3 years ago, we had 2 major casualties who came in who used 220 blood products over the course of a 5-hour period. That would totally eliminate our inventory. And the problem is we would have difficulty replacing it. Being down even a little bit begins to represent a potential threat to the system.